All right, so we're going to do chapter 15 today. How's everyone doing? Good?
Yes. You.
I don't always answer chat, so if you need something, it's like flag me or holler at me. It didn't make a sound or anything, so I have to go back and constantly check it. What I did was, you all can see my screen, is that correct?
Yeah.
I got two mock certification exams up here. This is from the content provider for your book from your publisher. I'm going to show you what that looks like real quick. So on student resources, you don't have access to this right now, but I'm putting it up here for you. So like you're not missing out on anything. There's two mock certification exams in here. And they're posted right at the top. Everybody should be able to see them at this point. And so they are timed 90 minutes. So it's 100 questions. You've got roughly a minute for each question. I think if you were trying to like really make sure you were in the time zone for each question, time spent on reading it and answering it for your certification exam, you'd be looking at about 30 to 40 seconds each. And that's if they didn't give you such a generous 3-hour time limit to go take the test. Okay. So you've got lots of time to take your test. Like I've told you all along, nobody should ever be worried about running out of time in taking this test. You could read it, you could take it probably 10 times over when you sit down for it, actually. But here I've put 90 minutes to kind of help you think about what it's like to be thinking quick on your feet and stuff. You could take it as many times as you want, and it's going to average your score from all your attempts. So the more you take it, the better you do, the higher your score go. It'll both of these will keep doing that. I would strongly encourage you to either start practicing with that now, or here in the next week or two you can save them. I'll put more stuff up here, but make sure you do at least try to check these out. Okay. All right, so guess what, as phlebotomists, you're not only going to be just collecting blood. Guess what else you're going to be collecting? Pretty much any bodily fluid that you could think of that could come out of someone. Is that not encouraging for you?
Yay.
Yay. We are doing 15 today, right? Or was it 14 that was on our little agenda?
I think 14.
My bad. Yeah, 14. I guess I need to look at it here. Make sure I'm doing it right. I don't know why I'm having such a hard time this morning. Thursday, February 10th. Chapter 14. Okay. What I have up on the board right now is the online version of one of the books. The page numbers and stuff won't be the same, but if I want to show you like a picture, I can. But that will be pretty much the same as the chapter we're looking at in your book. This is just like one version behind. So we're actually, did we not cover already glucose tolerance test and post-prandial test and all that stuff?
Yes.
We have, haven't we?
Yes.
We haven't covered like semen collection and throat swabs and stuff, is what I was wondering.
No, we haven't done any of that.
Okay, so I put the wrong chapter on there. Let's look at 15, actually. 15. So sorry. Chapter 15. Special non-blood collection procedures. Yeah, today's 2/10/22. Okay, so yeah, you can collect all kinds of things. Let's talk about this. We've got blood down. Give me another bodily substance. We
Urine.
talked about urine. You're in trouble. Get it, urine. Throat swabs. Nasopharyngeal swabs. Semen. Stool. Fecal matter. Doo-doo. Your book lists things like sweat, which I guarantee I would wager you a milkshake. You all will never be asked to collect sweat on anybody in your lifetimes. That would be a super rare test. Cerebral spinal fluid, you would probably be more likely to run a sample for. Does somebody have a question? Or somebody going to say something? Cerebral spinal fluid, the fluid that encapsulates your brain and spinal cord, helps those organs to float within the meninges. Because people with head trauma or head injuries, they might need to come in with something clear leaking from their nose. And if usually they have a skull fracture that they're trying to pin down, that will be leaking out of their nose, just like a clear liquid. What's neat about it is if a drop of, you can, one test a neurosurgeon taught me, I used to work in a neurosurgery office, so I saw this happen a lot. If a patient come in with suspected head injury and they were leaking that stuff in the office right there for that visit that day, this old doctor called Dr. Herring Nada, said you could take a white piece of paper and drop some cerebral spinal fluid on it, and there will be a green halo develop once it dries and evaporates, which can kind of be like a litmus test right there at the bench or in the exam room for CSF too, which is kind of neat. I'll never forget that. Okay, so we're going to talk about collecting all of this stuff because as phlebotomists, we can be tasked to do that. And that's what we're covering today. Shouldn't be too much to talk about. You know about random and time specimens. Okay, can you give me an example of each? Anybody? What's an example of a time specimen, Kayla? Where it's blood or okay, random, you can just think of a random urine test for a drug screen. How about just a random blood draw? If it's done at just no certain time with no certain requirements, like you're going to get a CBC, that could be considered random, even though it's ordered and it looks like a normal course of things for you all. Timed could be therapeutic drug monitoring, where you're going to check the levels that's been metabolized and excreted over time. You might have to check it here and here in the peaks and valleys. Remember that conversation?
Yeah.
A fasting blood test, I would consider timed because it has to be done early in the morning before they eat. It's scheduled, And then the rest of these pretty much will fall under urine for this chapter. Okay, so urine is the first thing we're going to cover here. I'm going to write it in yellow. Some little dribbles right here. Anything to help y'all remember? Looking at page 236. Okay, so we've already talked about random, and you can imagine what a random urine test would entail, right? We did drug screen, I've already mentioned, or just a regular urinalysis, which can be termed like this, UA or UA. That's abbreviation for urinalysis. If we just want a snapshot of how their kidneys are working, how the metabolism is going in their body, what they're excreting, what they're not excreting, we might get a urine sample. We can also do it to test for, anybody got a guess? What else might I be looking for in the urine?
Infection.
Yeah, test for urinary tract infections or cultures. If we do detect the presence of bacteria, we may need to get a little bit more sample or use the same jar of stuff we've already collected to start a culture, grow those bacteria enough to where we can put them in a petri dish. And so if you've ever seen a petri dish, I'm going to show you a picture since we're on the internet, which is cool. Looks like this. Everybody can see that round thing. You'll take like a thing, a little swab. You'll swab that plate with that Q-tip that may have that potential bacteria from the urine on it. It will grow because what's in these little jars is just food for that bacteria to eat and thrive on. And when we get enough to see the colonies in this dish like that, okay, we may end up dropping little pellets of antibiotics in there. And so this one might be a clindamycin. These are familiar enough names for antibiotics, right? It could be penicillin or zithromycin, whatever they've got in their arsenal that could treat something that they want to test. And so it may take 48 to 72 hours to grow that initial culture dish. They'll take a little thing and go plop and plop some antibiotic discs down in there. And they'll come back and look at it after a certain amount of time. And around these discs, there will be a clear area where everything has been killed at a certain radius. You might still have your bacterial colonies out here.
That's very cool.
It is. I did this in my 8th or 10th grade science class, not with urine, but with just anything we could grow off the Coke machine or the fountains. It's super easy to do. And so if you look at these rings, you can compare this distance and say, okay, well, this antibiotic, it killed more bacteria than this one. So this bacteria is sensitive to whatever it is. And then you can tell the doctor that, and they can prescribe a medicine that's within that class of antibiotics, and then the patient's going to get treated a little bit better. We're trying to target what we give them. And that's the purpose behind a culture. You may or may not be involved in many steps behind in the lab. I've never heard about anybody doing this type of test. They just collect the sample and they might run the urinalysis. But the culture and sensitivity is going to be back in the microbiology lab where they're doing cultures for like blood and stuff too. And they'll be hopping. There's people always doing urine cultures. So I'd say you will be involved in that sometimes. Pretty cool. Other urine issues. Okay. First morning specimens. Somebody tell me what they're good for. I think we talked about it last time we were on Zoom together.
Pregnancy tests?
Yes. And so if we're going to do a UA on someone and test for the HCG hormone, then we want to do it with the first void. And so I'm looking at page 236 at the top, also called an 8-hour void. It's collected immediately after the patient wakens. It's concentrated, and it ensures that the detection of chemicals or pathogens may not be found in more dilute random sample. Among other tests, it's used for pregnancy testing, as the concentration of HCG is greater in the first morning specimen. Okay, the sample should be delivered to the lab within 1 hour of collection to prevent breakdown of unstable compounds. I know in the nursing home, whenever I took urinalysis, okay, whether it was for a UA or a UA, C, and S, which is culture and sensitivity, it could be one of these two things. I could put it in the fridge for up to, I think 48 to 72 hours. So if I took a sample on Friday night, when the lab tech came in on Monday morning, it's still a great sample to use for these tests. HCG might be a little sensitive and to degradation after an hour. I don't know why your book states this exactly, but it can go longer than 1 hour for sure. If it's refrigerated. If it's not refrigerated, that all changes. Why is that, Aaron? This is a great phlebotomy question. I want you all to really think about this. What happens if I wait 1 hour versus 6 hours at room temperature with a sample? Anybody?
The
I'm not gonna.
bacteria is just gonna eat it up.
Bacteria are gonna what?
Just gonna like eat it up.
They're gonna grow. You're in the right zone. That's what I'm looking for, is that answer from bacteria, because in 6 hours they might have multiplied millions of times, and we're going to have a false level of bacterial infection compared to what's originally in there. So you want to get it right at that time, that snapshot. Refrigerating bacteria makes them stop growing because bacteria love warm, moist, dark places, you know? So we want to prevent that growth. Excellent. Also, for patients with certain metabolic disorders, you can look at time specimens again, and there is a 24-hour collection. Hope y'all can read my writing. I'll get better. That can be like collected over 2 hours, 12 hours, or even 24 hours. So say a patient just had prostate surgery. We're testing their blood for, or testing their urine for presence of blood, or somebody who's had bladder cancer or something. Or maybe this had a kidney transplant. We're going to take, we need more than just a snapshot. We want to see what their metabolic activity is doing over 24 hours. So I might go in and collect it, all of it. I might have a catheter coming out of their urethra to a bag at the bedside. And as a nurse, at the end of each shift or every so often, I'm going to go and take all that urine and I'm going to put it in a big jug. Biohazard. It's going to go to the lab. And they'll have 24 hours worth of data to see what's coming out, if it's getting better or worse. Where do you think this sample is going to be kept at, or this collection, while I'm collecting all my urine?
The fridge.
In the fridge. Very good. And then clean stream catch, midstream clean catch. Be prepared. You might have to prepare your patient to, here's a cup, I need you to go into the bathroom and pee for me, but you got to do it midstream. So they're not just going to put the cup underneath them and start peeing in it. They need to pee, catch it, put that cup away, and then finish peeing. And so what happens is the initial flow of urine will flush out any bacteria. Hopefully, the idea is to hopefully flush out any bacteria that's just hanging around the opening of the urethra that would be there naturally on your skin and not present in your urine. You don't want those to be like giving you a false report. So you're going to start peeing, flush any of that out, and then catch it midstream. And you might have to instruct them to clean, with a wipe prior to, like an antimicrobial wipe. They might have to clean their genital area first, start that stream, stop, catch, and then go on. And you can see that in the paragraph here. Okay. Nurses collect these all the time. And I think it's pretty much standard for us to, every time we're going to do a sample, we want a midstream catch. You can get samples out of that bag, that catheter bag. But are you allowed to, you think, access this? Probably need a nurse to go get it out of the bag. It might be allowed, might not be allowed, depending on where you work at. I'm looking down here at catheter collection. Are you ever going to put in a catheter or a tube into anybody?
No.
And right. And plus, this is a sterile procedure here, putting a catheter in someone. It's nothing special, but it is a sterile procedure. And most of the time, you got to be a nurse to do stuff like that. And then it's pretty rare, but they can put say I got a belly here. This is your abdomen. Here's your belly button. Sometimes they'll put a big needle in here straight into your bladder and collect it that way. That's called aspiration. Same thing like an amniocentesis, where they might put a big needle into the belly and get some of that amniotic fluid out and test it. That pretty much covers all of urine except for drug testing. What do you think we need to mention about drug testing and remind you? What's going to be involved in that for you as a phlebotomist? Anybody but Aaron? Demi, you're familiar with the criminal underground, right?
What?
Just making sure he's alive there. If I'm doing a drug screen, then I've got potential for this evidence to be presented in court, right?
Mm-hmm.
Something to that nature. So I'm going to have to do like a chain of custody for him. Do y'all remember talking about that a long time ago?
Yes.
You can look at it here on page 237. But that means you got to follow protocol. Everybody's got to sign in on who touched it and stuff. And if the chain of custody is broken, then it's a bummer. Fecal. It's kind of similar in that you can have a random or maybe a 72-hour test. When I was a kid, I had cat scratch fever. I was like 9 years old. I had to collect my poop in like a Tupperware cup for 3 days. I'll never forget it. And then take that back to the doctor. It was a terrible disease, you all. This huge knot came into my shoulder that he had to stick a huge needle into my armpit and aspirate like 30 mLs of fluid. It was disgusting. I remember carrying it down to the lab and it was warm. I know it's more information you were prepared to receive today, but if it helps you remember anything, I'm super happy about it. So what are we going to test for fecal?
Parasites.
Yeah.
Colon cancer.
Yeah, very good. O&P, ova, and parasites. Ova is the egg, parasites is the adult form. Either one can be coming out in fecal matter. It's how ringworms, hookworms, a bunch of other stuff is spread through fecal oral route. Yeah.
This is Aaron's favorite.
I said blood, and that was Aaron's favorite.
Yes, she hates worms.
Parasites. I can't. Whoo.
It's what?
She can't stand even the thought of worms, parasites, anything.
Oh, there's this video called Monsters Inside Me.
Yeah, that show has destroyed my brain.
That's what they watched the whole time I was in India for 2 weeks. I was like, just look at all the parasites in people. Another important test is an occult blood test. And so an occult blood test, this word right here, when I see it, I think of like, hooded guys in mask in the occult. They're kind of hidden underneath. They're present, but they're hidden away in society. And so blood can be hiding in your stool and you wouldn't know it. Bright blood is not something we test for. And even though we see bright blood in the toilet a lot with our stool, it's not really something to get excited over ever, medically wise. As a doctor, I'm like, yeah. I may be a bad doctor, but that's how it is in my mind. What I'm more worried about is the blood I can't detect in your stool. And so if you have a slow, insidious GI bleed that we need to identify, or we think, say your blood keeps coming back and you're anemic, your red blood count's low. Well, where are you losing that blood to? Or are you losing that blood? Oftentimes it can be through your GI tract and will show up in stool. If your stool is like, you can look at it and say that stool is bloody from old blood, it will be dark, tarry. But sometimes I can take a sample, even at bedside as a nurse, and I could smear it in a little card and detect the presence of blood right then and there. Or I can just send a sample off to the lab for occult blood, or I could do a 72-hour test. And all of that, there's all kinds of different ways to take those results and diagnose different things with it, but that's the general premise of it. We also might need to test, you got colon cancer, right? I don't even know if your book mentions colon cancer. But you see the commercials about doing it at home with the box, right? The cute little colon cancer box.
Yeah.
And then say you've got some kind of, what's a Crohn's disease or something like that, IBS, we might look for fatty stools. There might be a lot of lipids in there that you're not processing. Maybe your gallbladder is going bad. So that too. The biggest thing is training your patient not to pee in the cup that they're pooping in. I'm not trying to be gross right this second. I was earlier, but like you give them a little white potty hat that goes over the toilet seat. They're supposed to put a stool sample in there. Well, what do you often do every time you go number 2? You go number 1 right before or after that. And it's really hard. Sometimes if they do that, you're going, well, sorry, I can't take that sample. Come back and try again later, or take this home and put only number 2 in it. So patient education. That's 2 things I've mentioned here for you. You'll probably never collect urine on an infant. I'm not sure I would really focus on how to do that in the procedure. That's just stuff you don't need to worry about right now. Any questions about that? Okay, let's look. Somebody talk to me. What are you thinking? I'm talking a lot today. Are you all getting this? Is it boring?
No, I was just,
Okay, we'll get through Semen and I'll give you a 5-minute break here. And you can blow my nose. So semen, there's a couple things you need to know about it. What do we test semen for? Well, is the sperm viable? You know, maybe sperm is born and it didn't last as long as it should. Is it morphological issues? Like, you don't want to see sperm in there with 2 tails, right? That's a problem. This means their development, how they look. There's rape victims, which I think a nurse will be doing that. You have to be trained to do that in Kentucky for sure. I'm not sure why your book mentions that. Fertility testing, which I guess would fall under viable. Okay, so look at all the stuff you need to make sure your patient knows what to do when they're providing a sample. Abstain from ejaculation 3 days prior to providing a sample. Okay, this allows an actual volume to be built up, allows sperm to be hanging out and to be fully developed, to be looked at under the microscope. Okay, they should record the time. So like AM versus PM, I guess. That's not really going to matter, but what does matter is the time that it was collected to the time it's delivered to the lab. Most oftentimes, these are going to be collected at home by people. They got to have 30-minute window here, is what your book gives you. Other labs may have different policies, but as soon as they get the sample, they need to bring it into you after 30 minutes or less. It's like a Domino's pizza. You guys know they used to like give it to you for free if it went in there in like 30 minutes. And so delivery drivers used to wreck and stuff like that. They quit doing it. Like temperature. There's a reason that male gonadal anatomy is close to their body. They need a certain temperature for sperm to stay alive. A guy who sits on his couch and does homework on his laptop all the time can actually increase his temperature down there, and it could be damaging to semen. There's the boxers versus brief debate. You know, sometimes they say briefs are worse because they hold them closer to your body. They keep temperatures higher. Sperm may or may not be affected, versus boxers, which decreases the temperature enough over a period of time to make a difference. And you know, the more people are having issues with fertility and stuff, the more that can be dug into. We're just looking at the top overview of tests. Okay. And I think that pretty much covers that. So you need to educate your patient, document the time collected, get it to the lab within the specified window, abstain, and keep it at the right temperature. Don't put it in the fridge. You might even want to put it between your legs as you're driving it to the lab. No joke. Any questions there?
No.
Okay. All right. Take 2. I need to go blow my nose real quick.
I was hoping nobody heard Tucker come into my bathroom and pee because he left the door open.
I was hoping I did my volume so nobody heard me peeing.
I was like, I gotta pee. And then I was like sitting here smiling because I was like, that is so loud, Tucker. You should have shut the door.
the last big thing we're going to talk about is throat swabs and nasopharyngeal swabs. So why would we collect these type of samples?
Strep.
Yeah. What's everybody being tested for right now?
COVID.
Give me some more.
Flu.
Okay. Don't know what the heck that thing is in the back of your throat, those white spots, right? Look for thrush
Oh.
or candidiasis, yeast infection in your mouth. What makes the big difference here is that these oh my god, why am I having a blank on strep? Strep in the throat or the nose?
Throat, ain't it?
Well, I haven't been tested for strep. I think it's throat. Are you sure about that?
I'm pretty sure.
Yeah, it's the throat.
I should know that. I feel like it says throat culture sample, throat swab is used to diagnose a throat infection. To determine the infection is caused by group A, Streptococcus bacteria, strep throat, for which antibiotics are an effective treatment. Diagnosis is performed either standard bacteria culture in the lab or a rapid test. We got rapid tests and standard tests for COVID things. You all know about that stuff, unfortunately. So, whoops. These two I know are going to be nose, COVID and flu. If you go back and look at some anatomy, okay. So up here, I've got, can everybody see that? This picture
Yes.
clear enough?
Yes.
You've got your upper respiratory tract, which is everything from here up, okay? If you got an upper respiratory infection, it's going to be something that's up in this area, like a sinus infection is considered an upper respiratory infection because that's where your sinuses up here have bacterial infection going on, and that's part of your respiratory system. Your sinuses are. Your sinuses serve the purpose to take air in from the environment and to warm it and to filter it before it gets down here where it's harder to kill things, okay? And so RSV, COVID, they're usually up here in the nasal pharyngeal cavity. You got your pharynx, which is in the back of your neck here, contains your voice box, and it connects from your nasal cavity in the back. And when they go in with the COVID test and swab the back of your skull, they're getting the wall of that nasal pharyngeal cavity. That's different from throat, where you're going, actually, I got the video ready to show you here for a throat swab.
The ones that make you gag.
I'm going to make you watch it just for a second. It's only 2 minutes long here.
Throat swab. Equipment needed for this procedure is
Can everybody hear the audio?
Yes.
Yeah.
as follows. Introduce yourself. Perform proper patient identification and answer any questions the patient may have. Perform hand hygiene and don disposable gloves. Some clinicians may choose to wear a face mask if the patient is coughing.
Oh, no.
What do you think people are wearing nowadays? Face mask or no face mask?
Mask.
And you might see them wear the big clear face shield, or just like this in goggles, or one of those two by themselves. Worried about one, people coughing and putting viruses and bacteria straight into your face, or maybe gagging and exploding vomit. You know, some people have a real sensitive gag reflex. So every time I've done a throat swab, I've kind of been doing this number in case they do projectile vomit, or I'll have PPE on. And I'll tell you why that is.
Open the sterile swab package and remove the swabs from the container. Do not separate the swabs from the plastic top, but hold them together to swab simultaneously. Ensure that the patient is seated comfortably with the mouth wide. Ask her to say ah. Use your flashlight to observe the oral cavity for any abnormalities, such as inflammation or ulceration. While holding the patient's tongue down with a depressor, touch the tips of both swabs to the tonsils and any other inflamed areas. Include any areas of redness, white pockets, or pus, taking care not to touch the uvula, tongue, or lips. Discard the tongue depressor into the appropriate biohazard waste container. Place the swabs into the transport tube, swab end first, and close the tube. It is extremely important not to contaminate the outside of the transport tube, as this could cause a health hazard to yourself and other laboratory workers. Appropriately label the specimen according to facility protocol. Thank the patient for her cooperation.
Yeah.
Answer any questions she may have.
So, what they're telling you about potential health hazards is when you're trying to get the sample into the jar, you don't want to be like doing this number and then getting it in there. You want to put it in there without touching the sides on the outside. Seems like you don't want blood from a tube to be on the outside of the tube. If you got blood in your gloves, you wouldn't pick up that tube. You'd change them first, right?
Right.
Right. Common sense stuff. Hopefully common sense. Common sense is not very common. So if I didn't say it, somebody might do it. There's all kinds of different applicators and Q-tips and stuff for collecting these two types of tests. The one that I associate most with nasopharyngeal swabs, even though I've been swabbed of both types, is a flock. So if you were to zoom in on it, it would have like little tiny feathers on the end. And to me, this is more for getting all kinds of different surface area, because when you put it in on the nose, things that are sitting on nasal hairs or maybe in a little pile of mucus somewhere in the back of your sinus, you have more chance of capturing them with a little duster that's going in there, as opposed to a slick, compressed, hard wad of cotton. And so what you're supposed to do with a Q-tip, if you go into the throat, you open your throat, you see a white spot in the back. Everybody knows what that's like. Probably you got kids or tonsils in the past. You want to put the Q-tip directly on that spot and turn it so that all the surface area, you're turning this thing back and forth and rolling it on that spot to get as much of a bacteria sample as you can on it. And then when you put it in the jars, okay, the jars can have either a solid medium in the bottom. This can be solid, it can be liquid. Whatever it is, it's going to go down in there and preserve it for whatever type of test it is. That'll all be made and manufactured prior to you doing that. So sometimes it could be liquid, sometimes it can be solid. Sometimes it could be a sponge at the bottom that might or might not have a chemical additive or preservative on it. Any questions about that?
Nope.
Okay, it's important. You don't want to touch the uvula, tongue, because the tongue has all kinds of stuff on it. So is the uvula or the lips. You only get that one spot, so that's what your sample is including. Hopefully you all are getting familiar enough now to where you're like, okay, I can't contaminate these results. I gotta make sure I'm collecting these results to prevent pre-analytical errors. Outstanding. Let's practice a couple questions real quick. Well, I can't do that. I'll have that. I'll get it. I'm not going to pay them $50. I can call them and get a free copy of it. It expires after 1 year. And so I'm going to log into the very thing you could purchase. I won't recommend anybody in this class purchase it right yet. But I can go through those questions. Like we were going to look at a few of them on their practice exam. The people that's actually administering your exam, they have stuff you can buy to practice their material. So let me get that, and we'll do that together in class as part of review next week. They're a little bit more formatted, like your test is going to look like, as opposed to my textbook questions, and a little bit more critical thinking stuff. So let me get that set up, and on Tuesday we'll do a lot of that. I think the rest of our meeting times together pretty much be review and stuff. Okay. So make sure next week on Thursday, you really try to make it for your urine screens. If you don't, then that means you're going to go to Russell Springs at this point. That's going to come a third time. So that'd be the 17th. Okay.
Luna.
And then next week we'll do a lot of hands-on. I've got all your charts right here. I'm working on the clinical stuff today again, and so nobody has any questions. What is that? Is that your dog, Kayla?
That's my dog.
No.
It's Mara's dog. She don't like the neighbor's dog.
Oh, yeah. Come here, Sophie. Come here. Come here. Come here.
Luna.
Like 1,000 years old.
Oh,
Oh my God, she looks just like my dad's dog that died a few years ago.
Yeah, I can't wait till she dies. When I started dating my wife, I was like, okay, I don't know if I can date this girl because if her dog is an a-hole, she's yippy, I can't do it. Sophie's she's poodle. She's super smart. She just
no.
she's too smart for him. Good. She's getting old. She starts peeing on the kitchen floor and stuff. So I'm waiting on her to move along to the next life.
I have a wiener dog mix that's getting old, and he does the same thing.
I had a wiener dog once. He was the worst at dribbling pee everywhere. My son, it's going to be hard. I'm never going to let another animal in the house. Maybe a gerbil, but there will never be a dog living inside my house again for the rest of my life. I don't care how much they beg me. Okay. I will see you all next week. If you need anything, please let me know. On Canvas, please make sure you're checking that out and you're getting some practice in so we can talk about it when we meet. Because that's basically what our goal is. We just need to take a final exam is what I want to do for the rest of this class. The only other thing in a chapter test for what we just studied. I'm going to see if everybody can take this chapter test online. So everything that's on Canvas right now, nothing is for a grade. Nothing affects your grade on here.
Thank God.
But chapter 15 will. And I'm going to, instead of doing it paper like we have everything else in the class, I'm going to try to put it online and have y'all take it before we meet next week on Tuesday. It's going to be due before we get together on Tuesday. So that's your only homework is to take chapter 15 exam on Canvas.
Okay.
And I think I've got most of your grades entered and updated and stuff. And so I'll make sure all that's good stuff too. And then on Thursday or maybe the week after, we'll take our final and be done with grades. All right, then. Please let me know if you need anything. If you got a question, like I don't know why this was right and this was wrong, please email me, call me, Zoom me, and we will talk about it, okay?
Okay.
All right, you all. It's good seeing your faces again. I can't wait to see them for real next week.
Me too. I've missed everyone.
All right, great. I'll talk to you all later, okay, Mara? If you have some internet connectivity issues, we'll just give yours on paper when you come in. Don't even fret, okay? And that goes for anybody else.
Thank you so much. You have a good weekend.
All right. Bye.
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 Girls.